Let you know. Okay, thank you. No problem.
Yeah.
Thank you.
Thank you, Senator. I'm happy I didn't recognize that you were here, so you're recognized for your 6 minutes and welcome. Madam Clerk, please record her as being present.
I would like to thank my colleague for recognizing that I've been here. Appreciate it. Good morning to my colleagues, the testifiers. Good morning to the people of the territory. The first question I would like to ask is, can you share with me what has been the total number for change orders for this specific project?
Senator, I would not have that information before me here today.
Okay, so you came for a discussion on JFL, but you don't know a total. Okay, so do you know with all the change orders, what's the total amount of the projects thus far?
In totality, if I'm not mistaken, the original contract for the main facility was just over $48 million. The FF&E was approximately $27 million. Subsequently, there have been a number of change orders through the process. Now, that number, those are the numbers that are contracted for that particular contract. We also have the contract currently for the CMU building, which is approximately $11 million.
Okay, thank you. One of the things that was stated in the testimony had to speak about the leadership feeling that they were the most disappointed. I kind of beg to differ. I have a major concern with the fact that individuals, unfortunately, who have to leave the territory for cancer treatment cannot get services here because of this long-awaited project. They're the ones that's suffering, to be honest. They're the ones that most disappointed. But I understand you having some sort of connection or emotion to feeling disappointed, but the people that really need the services, they're the real disappointed ones. So what I want to ask, as several of my colleagues have asked, of some type of commitment date as to understand when this is going to be completed, because I was elected in 2020 and this conversation was happening. I was sworn in 2021, and I was here last year when we were talking about it being completed by summer. And here we are in the fall of 2022, and we are still having the same conversation. So I am really, really concerned as to really getting some type of idea or a legitimate ballpark as to the completion of this specific project in regards to the modulars and starting off to get that completed and letting that go into use so that we could really move on to the demolition and really start building out of this other JFL project and hospital. Tell me some time frames. I understand you're not putting numbers on certain things, but I need to be able to respond to my constituents when they call and they're frustrated.
Senator, with all due respect.
And yes.
Senator, with all due respect, as I mentioned in my testimony, some of the challenges that we were faced with, we know we had the COVID-19 pandemic. Unfortunately, there are other world events that are occurring, which has impacted the delivery of materials that are needed to complete the project. While we can sit here and say that, yes, this is our anticipated completion date, as I stated, we were faced with what's called force majeure, where a contractor by law cannot fulfill their delivery because of an act of God or something like that. Those type of events are unforeseeable and unfortunately has impacted the completion schedule. Bring fast forward, in my testimony, I indicated that barring any unforeseen circumstances, all mechanical systems are to be online as of October 31st, 2022. Prior to that,
outside of acts of God, I fully understand acts of God. Outside of that, are there any penalties in place in the contract for people not completing benchmarks or time certain for projects to be done outside of acts of God?
Absolutely. Every contract has built in if a contractor does not fulfill their responsibility. However, at this point in time, there are certain instances, well, most instances, that we could not hold a contractor accountable for any of these delays.
Okay. So basically, at this point, hopefully around a time certain October, we'll see something. I also wanted to ask a question about sanitation. I was listening in and reading in regards to porta potties and the utilization of those. And the hospital should have the utmost sanitary situations. Do you think that is a feasible situation or in the best interest of the hospital? Specifically, I guess we could speak to the CEO of the hospital.
Good afternoon, Senator. Doug Cook, CEO. Do I think that is the best use? No. We are, but I understand that this has been in place for going on before the actual hurricane. So we do our best to maintain those restrooms adjacent to the emergency room for our patients and for our staff.
Okay. Now, in regards to utilizing federal grants to do, for example, the modular and stuff like that, is there a time certain that these monies have to be spent? Have we expended all of it? Does any of this money have to be returned if we do not spend it by term certain? Could you tell me a little bit about that aspect?
Well, Senator, I really appreciate because you raised one of our major concerns, and that is making sure that we adhere to all the rules and regulations set forth by the federal funds to ensure that, one, that we will be reimbursed in its entirety and that we will not have to return any of the funds. So that is key to any decision making that we've been doing. Is there a time certain for time expenditure? At this point, no, because this is considered what we call Cat B, emergency measures that are the result of the hurricane. Until you could complete those emergency measures, that's the time, you're within that timeline. So there's no set timeline.
Okay. I think time was called for me, so thank you, Mr. Chair, for the indulgence. I, as a representative of the people, I am just hoping that at some point, thank you. I am hoping at some point that we are able to get this hospital to a place where we could start utilizing all the monies we have invested into these modulars so we can get the JFL up and running and built. So I'll be cheerleading you in all your work to get that done, but understand specifically the people of St. Croix, they're desperate and they really want to get some help in this regard because safety and their health is number one. If we're not healthy, nothing else matters. Okay? Thank you.
Thank you very much, Senator Francis Heidegger.
All righty. Good. We got it now. Good afternoon to my colleagues, to the people of the territory, to the testifiers and central staff. I first want to take this time to say a little bit of thank you. I had a issue with a constituent this week, and I was able to contact Human Services, and I had direct contact with Ms. Mikkel Reimer Brown, and she really provided me with necessary information and assistance to help a resident that really needed some help. So I wanted to publicly say thank you for that. I want to jump into my questions, and you spoke a little bit about payment to some of the smaller private businesses. What types of plans and what types of procedures do you guys go through so that private businesses can partner with your agency, more of the types of services to seniors that they need? Because like people that are looking to become entrepreneurs or get into that type of business, how would they partner with you guys?
Mikkel Reimer Brown, Assistant Commissioner. I thank you for that question, Senator, because specifically in this area of personal care attendants, I would recommend strongly that small businesses who are interested in providing services to seniors, you have to become a licensed business with the Department of Licensing and Consumer Affairs, and then you will touch base with our Medicaid program. You can do so even now, and you can get the requirements to become a personal care attendant. We will pay for those Medicaid eligible residents for you to go into their home per the prescription of the doctor. So if the doctor says you need 5 days a week and your business can provide that, we will. If you, once you're certified with us, you can be paid from our Medicaid program. We're also issuing requests for proposals for the St. Thomas, St. John District, and the St. Croix District for personal care attendance services. We anticipate those should be out before the end of the month of October. We were just awarded that grant. So there are several areas, but the personal care attendance program now will be one of the major ones. And then we're looking for a vendor who would like to do senior navigation services, who will assist beyond human services to help people in the community to connect, especially our seniors, with services not just in DHS, but throughout the community. So listen up by the end of
Excellent.
October.
Thank you. What type of strategic planning do you guys deal with transportation? As you know, sometimes seniors need to go out, get outdoors. Sometimes they need to get to medical appointments, doctor's appointments. What not only be inclusive, but also expand transportation services to assist them?
Also, with Medicaid, we have covered under a state plan non-emergent transportation. So Medicaid eligible members can call several entities and they can be taken to their medical appointments, or if they need to pick up prescription meds or other such related activities.
What if you don't have Medicaid? What options, are there any options available
Well,
if they don't have Medicaid?
Yes, if you don't have Medicaid, you have Vitran Plus, and Vitran Plus, they give very good affordable costs for seniors. As a matter of fact, that can help you. Those who have, as we know, Vitran, the regular Vitran bus is free for all seniors 60 years and older. So there are several programs that can assist our seniors.
As the population ages, what types of programs or extension of programs could be or are available in regards to people dealing with Alzheimer's, dementia, whether it's through Medicaid, Medicare programs? Could you please share with me and the public what types of programs are available in regards to these things?
Again, I think, Senator, we've been talking about the personal care attendance program. Medicaid on a hold will provide the health access that these families will need for those individuals who are dealing with Alzheimer's and dementias. Our programs throughout DHS assist these families. So it's across the department, but Medicaid and our Division of Senior Citizens Affairs provide most of the direct services to these families who are dealing with seniors and adults with disabilities.
In regards to senior centers, and this is just a twofold question, who deals with the nutrition, for example, if they go to some of these senior centers? And also, as the population ages, what are some of the plans that Human Services have to potentially, say, create more or expand senior centers? Maybe some of the government buildings that are available to be renovated, are there any plans in the works to potentially do any kind of build out or expansion as it relates to senior centers, as well as share with me a little bit about the nutrition programs that are available to them while they're at these centers?
So for the meals, actually, we have a nutritionist on staff that provides that dietary need to ensure that their needs met. So that's one option, and then the other, AC.
Yes, I just wanted to say we are going to be collaborating with VI Housing Authority on their new plans for WIM, and also another housing authority facility on doing recreational activities. My hope is in 2023 we can look at resuming recreational activities at Lucinda Millen Home. That was happening, as you know, the COVID has really taken out some of those activities. So we are very much open to collaborating with entities like Housing Authority and other private entities who would like to work with us and our senior center program.
Okay. Well, did I hear time? I want to make sure I don't go
you have
over.
a follow-up question, Senator? Your time was
Okay.
called.
Oh, no, I just wanted to wrap up and say that when it comes to human services, this is a very integral part of our community, as we always speak about the necessary things that needed, especially as we grow older. And when we have leaders in place that understand the need for this and making sure that the necessary tools are in place, whether it's the nursing aspect, the transportation aspect, the center aspect, those are very critical in making sure that the lives of Virgin Islanders, especially in their golden age, it's pretty good. So I want to thank you so much for giving me the additional time, and good afternoon again.
Very well. Thank you. Before we